have to move on to the next talk, and the next speaker is Dr. Gaurav Luthra, and he will be talking about what have I done differently this year in refractive surgery. So that's a very unique topic, and let's listen to him what he has done differently.
Thanks, Rajesh, and thank you, Dr. Namrata, Rajesh, and the whole AIOS team for inviting me to speak here. Are my slides and visible and I'm
Yeah, yeah.
audible, right? Thanks. So I thought I'll just put across these few things that, it took me back almost 20 years when I started doing LASIK and with this pachymeter and topographer. And, that used to suffice with what we were doing with PRKs and our microkeratome LASIK. And we were so happy at that time. And now, with all these gamut of equipments, it's made things life has become so complex. Yet, I think for patients, it's added a lot of value. I mean, what Rajesh just said that, we've become wiser over the years. So of course, the Pentacam, which probably still remains my most important instrument today, in spite of so many other things available to us. But I think I wouldn't manage a single day without a shine plug imaging. And I think what we, over the last few years, last 4 or 5 years, we've become more and more dependent on epithelium thickness mapping. All of the speakers have spoken about mapping, and so I won't go into any details, but it really helps us not only in evaluating our patients, but also our enhancements and the surprises that we might see, sometimes picking up eyes which are suspicious, or enhancement eyes where you want to do a planning, especially if you're doing a surface enhancement procedure, or if you have refractive surprises following refractive surgery in the early periods. You can actually see the epithelium, and it can tell you so much of how to handle these patients. If there is asymmetric healing, it can give, you can give more time to the patient for how the surface is going to change over a period of time. So it's quite intriguing and really nice to have epithelium mapping available to you for every patient. Now, the other device which has really helped us over the last few years, and again, a lot of us have spoken on that, is the eye trace. So I will not go into the details of what an eye trace can do, but I thought I'll share this one case which came to us, a 25-year-old girl with one eye stable correction for about 2-3 years. Right eye showing a correction of almost -20 with a 3.5 cylinder, improving only to 636 in this eye. So it was a amblyopic lazy kind of an eye, and the other eye was good and improving to 6.9 with a smaller correction. And we had to plan a surgery for her. She was going to get married, had significant anisometropia which she wasn't able to handle, and surprisingly the pachymetry came really small. And since she had a stable refraction for a few years and was keen for a refractive surgery, we had to find an answer. The AC depth was adequate for any kind of phakic lens implant. The epitheliums looked fine. Now here comes what we are all talking about. The left eye showed a DLI of 10, and that was quite good for undergoing any kind of a procedure. And the fellow eye showed just about a 1.21. Now this was the right eye which had the -20, and you can see that the also showing that potential visual complaints in the right eye with all the blur and the night myopia, whereas the left looks pretty good. So we had to take a decision, and this you can see here that the internal aberrations are very high in the right eye, and we decided to go for a clear lens extraction in the right eye, and for an ICL in the left eye. And post-op, right eye has a DLI of 10. So you can see she improved to 6.9. It was remarkable for the right eye because the patient was so happy. She was almost comparable vision in both eyes. And this was one big example of how technology can, help us in making better decisions. So this is only one way how the eye trace has helped us, but I think for every patient, it gives me more and more information, and it helps you make these decisions much better. Now, here's another patient who was having a small refractive error, was seen by us for potential refractive surgery. And she had this inferior steepening. Otherwise, the maps were pretty good. And the Weberian ambrosio maps looked fine, but they were borderline there. And epithelium thickness looked fairly good. Now, because of one, yellow flag, as you might want to call it, inferior steepening in one eye, which was not even significant, we thought a small correction, decided to go with a surface ablation procedure for this patient. So treatment plan was this. Here I wanted to bring in something that we've been really enjoying over the last couple of years, is the Trans PRK with the Streamlight platform on the Excimer EX500. So I think here what's most important to have is a good epithelium thickness map, because you can be surprised that a 480 cornea can sometimes have a 55 microns epithelium thickness, and sometimes a 600 cornea will have only about a 50 micron thickness. So you can't go by a thumb rule. And I think Streamlight results have been dramatically better. We've also been using ketorolac soaked contact lens, as Dr. Kudlu said. We've done studies for about 3 years, and we've also done the initial studies for the new product which comes from Entod. So planning, of course, I think all of us who are using this platform will be aware you can feed in the epithelium thickness over here. The only problem is that you can only feed it in gaps of 5 microns, whereas I think on the Schwinn platform, you can do it in steps of 1, 2, 3, 4 microns as well. And this works really well. I don't think a video is needed here to show how it happens, but once you've done the ablation and removed the epithelium and in one go done the ablation as well, you can use this contact lens. Now, this is something which I really find interesting, and it has really changed life. So I was sold to Smile for last 5 years that I've been doing it. But my patients post-op PRK now are no different from my Smile or LASIK patients as far as their pain is concerned. They look equally good. This patient was operated just 12 hours before the previous night, and reads, you can't make out most, no lid edema, no kind of congestion. She can read almost 6.6 on the chart, and very happy patients, almost no significant pain at all. So it's transformed our PRK practice over the last few years. Going on, I think what I'm really enjoying now is Contura treatments for those select patients where Contura is indicated. And, although a predominant surgery for me is Smile, but there are patients where Contura works really well, especially those with high astigmatism and with higher corneal aberrations. And again, now Contura we had been doing for almost 5 years, but what has transformed in the last 1 year is during the lockdown, we started using the Forcides software. And that has really, really transformed how we do our Contura planning and made our results amazing. I just wanted to share with you this one patient where we did a Contura treatment. This is how the screen looks like. So if you look here, this is the refractive error on top. So this is the manifest refraction. And then, of course, the topolizer measured refraction here. So mostly it is a cylinder which it will pick up. So you can see here the axes are a little off. And then you have the pentacam anterior, the topography anterior measurements, and the topography posterior measurements. And once you've put all this data into the machine, you get the final recommended treatment from Forcides. And you can see here that this gives you a very, very good. So I have become so reliant on the Forcides software today that I feel that it has, without this, again, I would feel disabled trying to do Contura treatments. It gives you the talus and the other vectors for the surgery. Of course, sometimes it will tell you not to proceed, or it will not calculate some of the eyes, and then you have to kind of go with a fine customized aspheric treatment or something similar. So this is the fellow eye. I will not go into the details because it requires a whole period. So essentially, I think our Contura results have been tremendous. Forcides has transformed our practice, and our quality data capture, I think, is the key to decide for these surgeries. Coming on to last, I'm not seeing the timer. Rajesh, if you'll tell me how much time I have left, maybe a minute or two, I'll just finish off. I don't see the timer on my screen. That's why I'm asking you. I'm sorry.
It's 25
but I'll try
seconds.
to finish. Okay, so in a minute, I'll finish. Okay. So this is another case, a 28-year-old male who came to us and stable refraction, correction of about -4 and -5 with a small cylinder, and slightly suspect cornea with superior steepening, and bad maps were suspicious and looking for a surgery. Now, these are the cases where you'll have to take a decision. And in this context, I would like to mention about this study which came out from Sri Ganesh's group about their risk of ectasia with Smile. Now, this patient was looking for a Smile procedure. We were going to refuse surgery to him. However, we've been doing about last 2 years a significant number of Smile extras, and I think Ritika and everybody else has spoken on that as well. These are the corneas, borderline corneas, which will do extremely well. And I think we've had great results with Smile Extra, very predictable. We are following the protocol of 60 seconds of riboflavin with 90 seconds ablation on the 30 milliwatt platform. I won't show you the video. I think it's self-explanatory, but it has again been a big tool for us to add to our armamentarium of procedures. I think I will not discuss here. So to summarize, refractive surgery has come a long way since we started. I'm saying 30 years, but probably it's 50, 60 years. But in the last 30 years, there's been a transformation ever since the excimer laser came about. And we have a gamut of devices which give us a lot more information today. And our understanding of the finer points in refractive surgery has grown so much. And a choice of procedures is now available for the surgeons and the patients, allowing excellent visual results and safety. And since each patient is different and should receive customized advice from us, I think it's very, very important that one size cannot fit all. And these are very exciting times for refractive surgeons. Thank you.